Hello dear students, since you are appearing for the MPharm examination tomorrow, I am giving you few tips. First of all, be comfortable and be cool, have a relaxed mindset. Don't feel that you are not the alone who are facing the examination. You should note that it is not only important to write the correct answer, but also you should write the answer in detail and in broad spectrum since you are writing the PG examination. And you should always underline the important points. So, overall it is more important to convince the evaluator that you know the correct content, and because of that you have to underline few important points. Scan the question paper. So, what does it mean? When you get the question paper, first check the QP code of your subject, so that you can confirm that you are writing the subject and the question paper matches with the subject the exam you are writing. Read the whole question paper and prioritize your answers. Start with the answer which you are very confident and perfect enough to write. And since you are writing for the PG examination, the answers will be for 10 mark. So, draw the diagram wherever you are having the necessity and draw the diagram at the center of the answer sheet and label it uniformly with the name, but not with the numbers. Use the thick pencil or the 2B pencil for the diagram. Since your papers will be scanned, if you use the thin lead pencil, the chances are that your underline may get dimmed. Because of that, use always the 2B pencil which will be having the thick impression. You should always underline the important point, and for that you have to have 15 minutes for checking the answers. For example, I have used the pharmacology answer here. There are two different models to screen analgesic drugs like caudal immersion method and breathing test. If you observe here, I have written in bracket used to screen centrally acting analgesics, and I have underlined it. Means what? You have to convince the examiner that you know that the caudal immersion method is for centrally acting analgesics, and it will be underlined, and so that it can catch the eye of the examiner. So, not only writing the correct answers, but also giving. You have to manage the time. First 15 minutes you keep it for reading the question paper and prioritizing your answers. Since you have 10 questions, equally distribute the time, means 15 minutes for answering each question. So, 150 minutes, and the remaining 15 minutes you use for checking the answers and underlining or rectification if any errors occur. Keep correct and essential margin. It is very important since your papers will be scanned for the evaluation. Always keep the little optimum margin, so that while folding the answer sheets, your answers should not get hidden, but unnecessarily also don't waste the space for the margin. Best of luck.